Burns are a major cause of accidental death and are usually caused by heat, radiation, electricity, chemicals, and sunlight. These can lead to life-threatening issues due to the fluid loss, infection, and the effects of those burned tissues. We categorize burns based on how much of the skin has been damaged. Superficial is a first-degree burn, partial thickness, second degree, full thickness, third degree. Now we're going to look at this on the next slide as well, so I'm not going to go into a lot of detail here. When we look at the severity of burns and we want to estimate the surface area of the body covered by those burns, we use something called the rule of nines, which divides the body surface into 9% or multiples of 9%. So for instance, if you look at this adult, if the right arm and right leg was burned, that is 9 plus 18, that would be 27% of the surface area of the body has been burned. It's pretty close on the infant as well, with just a little bit of change in those numbers due to the infant body being proportioned differently. So when a patient is burned and we've assessed the area, we need to look at how to treat those burns. So first and foremost, you want to manage fluid loss and control infection. Part of the inflammatory process that accompanies burns allows for widespread vasodilation in addition to damaged blood vessels, and fluids are leaking out continuously, weeping from damaged tissues, as well as just losing fluid through those damaged blood vessels. So you have to carefully monitor dehydration. And because the surface area, the skin, has been burned away and damaged, then our protective outer covering is no longer protecting us from those things that are trying to get into the body. So when we look at these burns, your first degree or superficial burns involve only the epidermis, and they're characterized by redness, pain, maybe a little bit of edema. So for instance, you get a mild sunburn. So how do we treat that? Well, cool water, cool compresses. If you want to, you could put some sterile bandages. Typical healing time is about 3 to 5 days, and usually no scarring. A second degree burn is a partial thickness burn, so the epidermis and the upper part of the dermis have been damaged. This is where blisters occur. So this occurs with very severe sunburns or scalding from hot chemicals or liquids. The treatment is similar to that for first degree burns, but we want to take special care not to break those blisters, which increase the risk of infection because we have poked a hole in our covering, so bacteria can get in. Now, applying ointments to the blisters is not recommended because that can cause us to retain the heat in the burned area. So you treat it pretty much like you would a first degree burn. Cool water, cool compresses, and give it some time and take care. Now, picking at the blisters, or if it doesn't heal properly, it can result in some scarring. Your third degree or full thickness burns involve the epidermis, the dermis, and the subcutaneous layer, which most of the time are destroyed. Third degree burns are usually caused by direct contact with corrosive chemicals or fire, or prolonged exposure to extremely hot water. Dehydration is a big concern with these because the entire portion of the skin has been lost and we can't retain water in that area. Most third degree burns require hospitalization and possibly skin grafting for patients with these third degree burns because with the dermis gone, the vasculature is destroyed, regeneration is going to be very limited. So skin grafts are an option to cover that exposed tissue and try to promote healing. When we talked about those melanocytes producing melanin to protect the DNA in the keratinocytes in our skin, that should tell you something pretty important. If our body has a built-in mechanism to protect DNA from the sun, there's something about that sun that's dangerous. And it is. UV radiation can cause mutations in our DNA. There is a gene called P53. When that gene is normal, it's all good. But when it's mutated, it has been identified as a risk factor for many types of cancers, including skin cancer. So overexposure to the sun is the predominant factor in the development of almost all skin cancers. Skin cancer is the most common type of cancer. It occurs most frequently in the areas that are most exposed to the sun, the head, the neck, the arms. Light-skinned individuals, especially the ones that have severe sunburns during childhood, are most at risk for skin cancer. So skin cancer can occur at any age, but the skin cancer risk increases just like most cancer risk does as we age because we accumulate more and more genetic mutations. So we should use sunscreen and avoid prolonged exposure to the sun. In addition to that, you should check your skin regularly, just like you do any other body part that you're worried about getting cancer. If you're worried about breast cancer, you do breast exams. If you're worried about testicular cancer, you do testicular exams. Why not examine your skin as well? So you should be aware of any new or changing appearance of things on the skin. There are 3 major types of skin cancer, and we're going to examine each one of these in the upcoming slides. Basal cell carcinoma is the most common type of skin cancer, but thankfully it is also the least dangerous. It rarely metastasizes, that means it rarely spreads to other locations in the body. It originates in the stratum basale. When it first appears, it's usually a small pearly white or pink sort of shiny elevation with small little blood vessels running along through it. Later, it may enlarge and sometimes even develops a depression with sort of a pearly looking edge. These occur frequently on the face and can be treated easily with surgical removal. Squamous cell carcinoma arise from the keratinocytes of the stratum spinosum. These lesions tend to appear on the scalp, ears, lower lip, and the dorsum or backside of the hand. Early lesions tend to be raised and red and sort of scaly. Later on, they may form concave, ulcerated little areas with elevated edges. Treatment is usually surgical removal. They may metastasize, though, to other parts of the body. Now, these include about 90% of cancers of the penis and vagina. Now, if you do find these quickly and have them removed with radiation therapy or surgically removed, the prognosis typically is good for a full recovery. Malignant melanoma is the most deadly type of skin cancer. It's aggressive, it grows fast, and it metastasizes. It goes anywhere and sets up new tumors. Now, it should be obvious because it is a melanoma. It arises from melanocytes, usually in a pre-existing mole. Individuals at increased risk are those that have had multiple very severe sunburns, especially during childhood. It's characterized by a change in the mole diameter, shape, color, or symmetry. Survival rates are improved with early detection and surgical removal, and very often immunotherapy as well. Advanced cases that have metastasized are difficult to cure, usually treated with chemotherapy or other medicinal therapy such as interferon and radiation therapy. Now, when you're looking at these, we can use something called the ABCDE rule to examine moles. Now, I'm going to swap to this slide so we can look at A, B, C, D, and E. So when you have a mole, you need to be aware of what it looks like, how big it is, what color it is. Look at all of these characteristics as defined by A, B, C, D, and E so that you know if it has changed and is potentially a malignant melanoma. So first you look for A. Is it asymmetrical? If you divide it in half, does one half of it look different than the other? B is for border. Are the borders smooth or notched, irregular, blurred, or ragged? C is for color. Is the color uniform? Is it one shade of brown throughout? Is it brown with black and red or other colors mixed in? Well, one color is good. Many colors is not. D is for diameter. If it is larger than a pencil eraser, it warrants observation and potentially getting checked. E is evolving and elevated. Now, if it is just elevated, but it does not have any other of these characteristics, elevated means raised off the surface of the skin. If it is elevated and nothing else, it's probably okay, but mention it to your doctor next time you're there. If it's elevated and evolving, it's changing, or it's elevated and asymmetrical, or elevated with many colors, then you want to be more aware and more cautious and have it checked more quickly. E is also for evolving. Was it small? Was it one color? And now it's large and it's asymmetrical and many colors. These help you look at your own skin and determine if there is need for you to have professional clinicians look at this. Guys, it's always better to be safe than sorry, because skin cancer, again, is the most common cancer in humans. And one last slide for this chapter is about aging of our skin. As we age, mitosis slows, so we repair and replace things less easily and less effectively. So the epidermal cell mitosis slows down. We replace the epidermis less effectively. Your sebaceous glands dry out. Your fat layer diminishes away and we're cold more often, and our skin becomes less plump and young looking. The elastic and the collagen fibers decrease, resulting in wrinkles. Botox is a toxin that has been basically inactivated so it doesn't cause illness, that is injected into the skin. What it does is to temporarily block the nerve impulses of your facial muscles and therefore decreases or eliminates the wrinkles that are produced by those muscles being in movement. This is done in a doctor's office where the Botox is injected into the facial muscles that are responsible for the wrinkles, such as frown lines around the mouth and crow's feet around the eyes. This is temporary and usually will only last a maximum of about 4 months. However, there have been side effects associated with the use of Botox as well. So I would certainly look into this and do some research before you decide to do something like that to your face. Now, in addition to that, your hair follicles become less active. Your melanocytes stop producing as much color, so your hair thins because we're making less hair, and grays because we are producing less melanin. So I really like this image. You can see the effects of aging and several of the things that develop, from the lines on the forehead, around the mouth and the nasolabial folds, the sagging skin. The cheeks become more hollow here, you can see as well. Under eye wrinkling and crow's feet and drooping eyebrows. So guys, take care of yourselves while you're young. You cannot prevent aging unless you die. Age gracefully. It's a natural thing. Let it happen.